Ansley, what are you doing over there?
Yeah. I'm listening to his heart. Zach's alive. He's
He
good.
is? Okay,
he has
good,
a heart.
good.
Yeah.
Well, now we're going to get started working on Chester chest. Dr. Ward has brought up 2 nursing students. We have Zach Williams and Tamika Burnett here to help us demonstrate some of what they are learning in nursing school. All right, guys, let's get started. We want to go ahead and start with Chester chest here. All right, so tell us what we're doing.
Okay, so we're going to be changing the pick line on Chester chest here.
Okay.
So in a real world, he would already have his dressing on that I would take off, and I'll wash my hands.
And this is a port, right?
Yes, this is a port.
Okay, so go ahead. Show us what to do.
I wash my hands. I'm going to go ahead and put my mask on here.
Mm-hmm.
Sorry.
And what are these ports used for usually?
You can draw blood from them. They can infuse
Should I put gloves on,
fluids.
too?
They can get antibiotics and different procedures.
Okay, so teach me something. Show me what to do here.
Okay, so now I'm going to get my gloves here, which are sterile.
Ooh, those are very sterile. I need some
You
gloves
need some
too. You
here.
want to pass those down? Yeah.
These are sterile.
I'm working on Chester first before you guys start with Mr.
Arnold.
Andy Arm or whatever.
Oh, Arnold.
Arnold Arm.
Jeez.
Okay, so we got sterile gloves on. We'll just pretend mine are sterile.
And Zach, as a student, what's does this? I'm guessing this takes a lot of practice too to work on these the different
Absolutely.
ports.
So with any skill that we do, we get clinical practice through our classes. We practice on mannequins. Some skills we may even get to practice on each other. And then we go to clinical, and then we do it on real patients.
Wow, you get to do it on each other. You know what? For the sake of TV, we may just skip the gloves because she can't get them on. What else would you do if you did have gloves
If
on?
I had my gloves on, then I would get
Yeah.
my alcohol prep here.
Okay.
And we would just clean all the gunk off of it.
So as nurses, you guys get used to seeing some pretty, what we would consider probably graphic stuff.
Yes.
How do you guys get used to doing things like that?
Do you get used to it?
Yeah.
You do. It's really not that bad. It fascinates me,
Zach,
actually.
thoughts?
The same way y'all get used to being on live TV.
Okay, that makes sense.
Good point.
That makes sense.
I got my chlorhexidine here. And you really want to get that disinfected there. And then you want to scrub for at least 2 minutes.
Wow. Okay.
So we're scrubbing.
Yeah. We'll pretend the 2
It's
minutes
been
have
2
passed.
minutes,
Yep.
yes.
Now, does this
This is-
hurt having this poured in for the patients?
It doesn't. It'll be a little sore after they put it in,
Mm-hmm.
but after that, it's not bad.
And then what is this you just put on?
That's just like a little antibiotic. That way it doesn't get infected.
Okay. And then while she's finishing this up, let's go ahead
Should
and
we
move
work
on
on
to our
Arnold?
arm.
Sure
All right,
thing.
what are we doing over here, Zach?
So we're going to put an IV in Mr. Arnold's arm. And the first thing we're going to do is we're going to put this tourniquet around it so that his IV, so that all of his veins really pop up. And that way we can see it, and we don't miss, and we don't have to stick Mr. Arnold twice, because then we wouldn't be friends anymore. Right?
No, people don't usually like that too much.
No. So we get our IV on there, and look at that big meaty vein right
Yes,
there.
that's a good
You
vein.
feel it? That's
People
the one
like
we're going
to
to
say
stick.
I have good veins in my arms.
All
I'm proud
right.
of that
Yeah, I
fact.
have one good vein too.
Do you have a good
Yeah.
vein?
So we're going to disinfect it,
Okay.
get all the germs off of it, because once we puncture the skin, we don't want to cause an infection.
And can IVs go in different areas on the arm as well?
IVs can. They can go in your arms. In some cases, they put them in legs even,
Really?
wherever they need to get a vein.
Okay.
So we
Nicole
take our
asked me
IV
if I needed
needle,
a chair for this. I may need a chair. Okay, go ahead.
and once we find our vein, we go into it, and then we drop the catheter down, we push it in, and a lot of people don't realize the needle comes out.
Oh, really?
Really?
The
Doesn't
needle
say
comes
in-
out completely, and all that's left in there is a plastic tube, kind of like a water hose holding it in.
Oh.
Okay.
So once we get our IV in the vein, we tape it down, and then we take a sterile dressing, we cover it up,
Wow, look at
And that's
that.
over there, huh? What is this, like a clear bandage going on top?
it's always clear so that we can see it in case it starts to bleed, in case one of our drugs starts to come out of it.
Uh-huh.
And then we always take a marker, and we always write our name and initials on it so we
On
know
the
when it was
sticker?
placed.
We will
On the
Look at
sticker.
that.
I
She
sure
did
will.
that over here as well. Is
Oh,
that
she
what you
did?
were doing?
Yes.
I
Did
thought
you write
you
your
were
initials?
writing with a Sharpie.
The initials and the date.
Look at that. Okay, now what did you put over here? Is that same thing that
It
you
is,
did?
yes.
What is this? A cover?
Yes, it's like a
I didn't
dermabond.
even
That
think.
way you can see, like you said, the insertion site just in case it gets infected or if it's get red or for some reason it was pulled out, you can monitor it.
Wow.
High five, Alicia.
Yes.
We did it.
Great job. Ansley, now I want to see you do it.
No.
Yeah. Yeah.
I don't know. We don't have any more IVs. We ran out, right,
let's
Nicole?
do it again. No, she said we have another one. She said we have another one.
How did
I
it go
wanna
over
see you
there? So the
try.
ports are all in?
Yeah, we're all good over here. We did our job. Yes. All right.
Getting really sweaty.
Well, guys, how much longer do you have at the College of
Graduate
Nursing?
in May.
How excited are you?
Very excited.
It's been a long few
Congratulations.
years,
Yes,
huh?
I love the program, but I'm ready to be done. Ready to be a real nurse.
Yeah, I bet you're ready to actually get started and do the work that you guys were called to do.
That's right.
Awesome. Well, congrats to you guys. And did they do a good job? You're over
did a
here
great
overseeing.
job. They did a great job. Those gloves always stick.
Yeah.
You know, we always give them the better sizes, and
Yeah.
I didn't bring her any.
Okay.
We didn't
All
need
right.
the gloves on Chester.